morning, John.
How are you?
Great, thanks. How
That's
are you?
great. We're going to make Dr. Sam a part of our morning family here. And I was mentioning, maybe you heard it when you were driving over to the studio. You know, when you wake up in the morning and sometimes your vision is a little bit blurry, but when that blurriness doesn't go away during the day, chances are you need to come in and see you guys just to get a checkup.
Right, John. If it's just a transient blur that you get in the morning, that's not a big deal for most people. But something that persists throughout the day, yes, it's time to look into it.
Time to come into Dr. Sam's Eye Care. We have heard about the InfantSEE program. That's INFANT, as in infant and baby, and then SEE, S-E-E. You are a part of the American Optometric Association's InfantSEE program. What is that?
Right, John. The InfantSEE program is a volunteer organization that has been put together by the AOA, the American Optometric Association. The main thing to know about this is it's a free program. People can bring their children in at a very young age for a comprehensive eye examination, and it's a critical time to do it. We are very much promoters of having comprehensive eye care for kids at a time when their vision is developing, and where you can catch things that if you don't catch them early, you're not going to be able to do anything about it.
You see more and more kids wearing glasses. I know when I was growing up in the 60s, it was rare to see a child with glasses, but then you didn't take your child to get eye care. How early should I bring my child in? Because this is infant, as an infant baby. I can measure my child's eyesight when they're, what, 6, 7, 8 months old?
Even younger, 4 to 6 months is really the ideal time to have a regular eye exam from an eye doctor. When they're very young, the pediatrician does a great job, typically, of handling all their eye care needs. But there are some situations that can crop up, and do crop up fairly often. About 1 in 40 kids ends up with a serious problem that does not get addressed when they're little. We have some special instruments and special techniques that we can use to look at kids.
Now, how would you test an infant of 4 or 5 months?
Of course, they all pretend that they can't read the letters on the eye chart, John, but we know that about kids. Kids can be looked at objectively. We don't, of course, ask them questions about what they're seeing, but we have instruments in which we can look at their eyes, and particularly we can look at the red reflex that you get when you take a flash photograph, something like that. It's a little bit different, the optics, but our instruments are able to measure their vision by using that red reflex, and that gives you a pretty accurate measurement on what they're able to see.
We're talking about the InfantSEE program and how you can actually measure your your infant's eyesight very early on with Dr. Sam from Dr. Sam's Eye Care. Now, if you diagnose and you see a problem in an infant, how do you then correct it? For an adult, it's easy. There's glasses, there's contacts, there's whatever else. But with an infant, what do you do to correct that vision problem?
Right, John. What we're trying to avoid in most cases is what we call amblyopia, which is also called lazy eye. And that can be caused by a number of things. One of the things that can be caused by is if you have a big difference between the two eyes as far as being nearsighted or farsighted, the child will just use one eye and not the other eye. And that'll become neurologically hardwired in their brain. They will not be able to develop that after the age of about 4, 5, 6 years old. So it has to be addressed before that. That can also be caused by double vision that can be caused by having a crossed eye or a wall eye, eye that turns in or turns out so that the kid sees double. They'll ignore one image, they'll use the other, and they will never be able to use the other image properly. They'll lose a lot of visual functions, particularly depth perception. Those kids tend to avoid fast-moving ball sports. They don't like to walk on stony paths. They will tend to avoid any kind of a situation in which they can't predict what's happening very quickly.
Dr. Sam's Eye Care in Claremont, our guest this morning here on News Talk 99.7 and 98.9 WNTK. We've got a cloudy day with a chance of a couple of sprinkles later on and a high near 58 at 44 right now. So I bring my infant into the InfantSEE program at Dr. Sam's Eye Care. Everything's fine at age 6 months. How often do I come back, and how often should I test my child's eyesight?
Well, John, I'd say in the perfect world, what I'd like to see is a kid gets taken a look at when they're a baby by the pediatrician, then at 4 to 6 months by a regular eye doctor. And by the way, there are probably 50 eye doctors participating in this program within this station's range. After that, if everything looks good, typically 2.5 years old, if they're going to have an eye turn manifest that does not happen when they're tiny, that's about when it'll happen. If everything looks good then we see them about kindergarten age to see if they're seeing well for looking at the blackboard.
Is it unusual for children at 6 months to have these eye problems? I mean, what do you have some of the numbers from New Hampshire, Vermont, from where we live?
Well, what it turns out to be is something like 4,000 people, 4,000 people up to the age of about 18 in New Hampshire and Vermont have eye problems that they have amblyopia, they have vision loss from these things that we're talking about that could have been prevented. It turns out that about 13% of kids get taken in for regular eye exams at these ages. And we want that to be 100%, John.
Yeah, yeah. And there's more information about this online at InfantSEE. And by the way, InfantSEE was something that was started way back in the Carter administration. So this thing has been around since the late 70s. And it's InfantSEE, as in S-E-E. InfantSEE.org is the information. Or you can simply go into Dr. Sam's Eye Care over in Claremont, and they will help you out. So, you know, I guess that's probably the best advice that I have ever heard with an infant. I would never in a million years until you walked in the door here this morning. And yes, I was able to see Dr. Sam when he walked in the door here. That you would test an infant, even test a baby in its first week of life.
Right. And I want people to understand too, John, that this is a free program, but this is not just for the poor. It is not for any particular social stratum. This is for everybody.
Right.
And we want everybody to bring their kids in
to Dr. Sam's Eye Care, and even the big kids like me who are squinting a little bit when I didn't used to squint before. And I probably need glasses, and I probably need to come in because I'm squinting now. And that's probably the first hint that you need a little work, right?
Come on down, John. We'll take care of you.
And, one of the other things, because, my mom wears glasses, my dad wore glasses. I don't wear glasses or contacts, and, knock on wood, my eyesight has been, pretty good in, the 150 years I've been here on the face of the earth. And, but I notice some changes. So at the first sign of change, that's when you should go in, because you can I correct the problem if I'm 50 or over, or just arrest the problem and have better eyesight?
We can give you better eyesight while you're wearing your glasses if that's what you need.
See what you learned here with Dr. Sam's Eye Care on Dunning Street in Claremont with the world's best telephone number. It's 543-2020. That's very easy to remember, 603-543-2020. Dr. Sam is going to be back with us from time to time, part of our morning family here. But you really should take advantage of the InfantSEE program at Dr. Sam's. If you have an infant, 6 months, maybe even younger, come on in. How young has someone been? But what is the youngest infant that you've seen so far in the InfantSEE program?
3 months is about the youngest.
3 months,
that we see
really?
kids. Right.
Really? And I would imagine, are they fairly well behaved, or do you have to wake them up sometimes if mom brings them in?
Well, yeah. One of the easy things about this is if kids come in before they're 6, 7 months old, they're very easy to deal with. And you can get a lot of good information. They haven't figured it out yet that they can bat things out of their faces, these irritating lights that we're shining at them and things like that. Once they get to be about 8 months old, they get it figured out that they don't have to put up with this.
Yeah. Dr. Sam from Dr. Sam's Eye Care with us this morning at WNTK. Peter's got a question for you, Dr. Sam. Peter, good morning. You're on WNTK. Your question.
Good morning, sir. The question I have is the Lions Club has a program where they take pictures of children in their eyes and then send it off to be diagnosed. Is this part of your program also coming up, and how does that differ from this? And the same logic is you try to find out if somebody can see sooner rather than finding out when it's too late.
Right. Thanks, Peter. That's a terrific program that the Lions Club has. It's unfortunately not consistent over the whole country. We'd love it if it was. They do a lot of good for kids. Of course, as you can imagine, it's a limited eye examination. Mm-hmm. What it looks at is a few of the things that we look at in a comprehensive eye examination. But they do a very good job of it.
Very good. Thanks, Peter. Thank you, Dr. Sam. Dr. Sam's Eye Care on Dunning Street, Claremont, 543-2020, 543-2020. And we'll see you back again very soon.